Refractive errors are most common eye disorders wherein our eye is unable to focus on objects clearly. Let me just explain you in simple terms. Our eye basically works pretty much like a camera which has a focusing system which is mainly comprising of cornea and the lens. These two structures mainly help focus all the objects which we see onto the retina. When we are unable to focus images precisely onto the retina, we end up with refractive errors. Most common refractive errors are myopia, which is also called as short-sightedness, wherein patients are unable to focus on distant objects clearly. Then comes hyperopia, wherein patients are unable to focus on near objects clearly. Astigmatism, patients see distorted images most often, and presbyopia is an age-related refractive error, almost universal, and sets in at the age of 40, wherein patients have mainly reading difficulty. Refractive errors cannot be prevented, but they can be managed if diagnosed well by an eye care professional, appropriately depending on the age of the person, the type of defect they have, and the requirements in terms of their work. The various forms of treatment options available, the most commonly being used is spectacles, which corrects the refractive error and helps in focusing the images properly onto the retina. And patients, if they use safely, they can even use contact lenses to correct refractive errors, which gives them more precise vision. And the surgical options are also available for patients who are more than 18 plus with stable refraction. Most common surgery being done is Lasik, with a very good overall satisfaction rate and outcome. There are few unfortunate candidates who can be unfit for Lasik. There are other options available for them. They can go for phakic IOLs like implantable collimator lenses. Cataract again is one of the most common eye disorder. Cataract is takes its origin from Arabic, which means my abyad or white water. It's a translated Latin name. It is mainly coined when the human lens, which is normally clear, becomes opaque and impairs vision. Surgery is the only treatment available for cataract, and the timing for surgery depends on the amount of visual impairment and the visual demands or the needs of the patient. The various surgical options are available these days for cataract. Most widely and commonly performed surgical procedure is phacoemulsification, which uses ultrasonic energy to break the lens into smaller pieces through a very small aperture made into the eye, and it sucks the cataract out, and then follow it up with implantation of an intraocular lens, which is mandatory to replace the refractive power eye needs to see well after the cataract extraction. The other surgical options is the old conventional extracapsular surgery, which requires suturing and has also fairly good visual outcome, but the unaided visual outcome may not be as good as what we get in phacoemulsification. And we have newer innovations also in cataract surgery. We do nowadays laser surgeries available, which is femtosecond assisted laser cataract surgery, which has more precise outcomes and also more safety in terms of complications. Someone rightly said, every closed eye is not sleeping and every open eye is not seeing. So we need to have routine eye checkups to make sure that what we are seeing is the best we can see.